Hi, good morning and Assalamu alaikum everyone. I want to present one more topic, and the topic is primary central nervous system vasculitis, and it is a primary central nervous system vasculitis, or we can say the primary angiitis of the central nervous system (PACNS) is a rare inflammatory disorder of the blood vessels of the brain and the spinal cord and occurring in the absence of any evidence of systemic vasculitis. And the clinical manifestation of the primary angiitis of central nervous system or the primary central nervous system vasculitis at the time of the diagnosis are non-specific with various presenting symptoms, and the headache is the most common presenting symptom in the majority of the primary angiitis of CNS cases. And other symptoms include the focal neurological deficits, include the hemiparesis, aphasia, numbness, visual symptoms, ataxia, all are there. And the, and, uh, and I am Dr. Muhammad Kazafi, and you are watching Dr. Muhammad Kazafi Views. So let's come to our topic, and topic is that the primary angiitis of the central nervous system is a rare inflammatory disorder of the blood vessels of the brain and the spinal cord without any evidence of the systemic vasculitis. And this primary angiitis or central nervous system was first described as a distinct clinical entity in 1959, and since multiple different clinical presentations have been reported, clinical manifestation of the primary angiitis central nervous system at the time of diagnosis are non-specific with various presenting symptoms, and the headache has been the most common presenting symptom in the majority of the primary angiitis central nervous system cases. Other symptoms include the focal neurological deficit, include the hemiparesis, aphasia, numbness, visual symptom, ataxia, and among other. And here I want to show one thing to you. So before going detail for the primary angiitis of central nervous system, you can see how it behave when there's some angiitis or inflammatory this rare inflammatory lesion will happen, and what it do, what it could do, or what can be done there, and how the MRI on the T1 or T2 or diffusion weighted images or on the contrast, how it is behaving, because all A, B, C, D, E, F, G, H, and all the images I, J, K, L till now, every means these 12 images showing all kind of the effects of the primary angiitis of the central nervous system, and it is, I think, worthwhile you can understand and see and memorize in the brain. Now I am going for this educational lecture for the patients and for the patient attendant and the doctors also. Yes, so the exact etiology and the pathogenesis of the primary angiitis of the central nervous system are unknown, but the infectious agents such as the Varicella zoster virus and the Varicella and have been postulated as one of the trigger, and the other proposed cause include the following, such as the bacterial trigger include the mycoplasma, rickettsia, or the treponema, or we can say the viral infection include the immune deficiency virus or the hepatitis C virus, among other, and the connective tissue disorder and the systemic vasculitis include the systemic lupus erythematosus and we can say the Sjögren's syndrome or Batchett syndrome or Sjögren's syndrome. So these all are involved in that. It is definitely tough to remember. It's not easy. That's why not many people are presenting these kind of cases. But this is my intention is to doing the things all kind of, because the should be availability should be there, so people have the option. If somebody wrote on that and somebody talked about it, I just want to put my input over it also, because you have the option that if you want to choose me, then you can choose me. If you don't want to choose me, this is definitely your choice, and I respect that definitely. But definitely, you know that there is a study which describes the exact epidemiology of this year. This rare disorder have not been done, and the only available data shows an annual incidence rate of 2.4 per cases per million person year, and the disorder has been found to have an equal distribution among both the sexes, and the median age of the diagnosis of about 50 years. So the specific activation of the immune system, and more specifically T cell by various triggers, are thought to cause the inflammation of the blood vessels in the central nervous system, leading to the pen, or we can say the primary angiitis of the central nervous system, and the immunohistochemical staining of the biopsy sample for the primary angiitis of the central nervous system showed an extensive infiltration around the small cerebral arteries by CD4, CD40, CD45, and ROT cells in the matrix metalloproteinase, such as the MMP, have been described as one of the primary effector molecule in animal model for the primary angiitis of the central nervous system. Histopathology regarding that the primary angiitis of the central nervous system shows the small and the medium vessel vasculitis, and affecting, we can say, the parenchymal and the leptomeningeal arteries, and the three different type of the vasculitis pattern have been described in the, we can say, the primary angiitis of the central nervous system, and these include the granulomatous type, necrotizing type, and the lymphocytic type. So the most common granulomatous and shows numerous granuloma with multinucleated cells, and the necrotizing type patient present with the fibrinoid necrosis similar, and the lymphocytic type showed the extensive lymphocytic inflammation with plasma cell. Before going further, as I mentioned, there are three kinds of the we can say the histopathology, or we can say the pathogenesis. One is the granulomatous, other one is the we can say the infiltrative, and the third one is the lymphocytic. So the granulomatous are more pronounced and more obvious, and it is involving the small and the medium sized vessels, and you see the how the microscopic blood vessels here, and the close-up of the brain tissue you can appreciate from this picture. And the large vessel, you remember that large vessel, which are the large vessel by this picture. And because this picture is already saying the 1,000 words to explain you in detail, and now I am proceeding. Now this picture is by themselves explaining you on the one side you can see there's a normal vessel, how it behaves, and you can see the other area where the irritated vessel wall and brain tissue, and you can appreciate here how it behaves, and the immune cells, what the immune cells are doing with that. So this is the pathophysiology I wanted to explain you, so you can make up some thing in your mind and you can understand. Before to explaining the evaluation and how we are diagnosing, but you can understand there the angiography is definitely very, very important, and definitely how they when the a lot of time and a radiologist are writing that there is a, we can say they are writing there's a vasculitis, a possibility of vasculitis. So sometimes we are not understanding there properly, because sometimes we are, because there is a rare problem and we are not means bothering, because we are only looking and going to check only the aneurysm. If we find the aneurysm, so we can do some heroic work, and then we, but I think in my humble opinion the heroism also that you can properly diagnose the patient and properly treat the patient accordingly, and then definitely you give the proper treatment. Or even you cannot treat the patient, you can actually transfer the patient or refer the patient appropriately to that specific area, or a specific doctor who can do better than you. So these things are very important, and I think nowadays if you are doing like this in a lot of countries, there are a lot of medical litigations are involved, and definitely if you are not doing things you have to do. But in a few countries where that kind of the litigation, only the rampage happen for them, and sometime and the big people are using their powers for to destroy the career of that doctor. So I think it should not be done. But this is not I'm not here with some political agenda. This is a 100% educational lecture. So I just wanted to tell you that we have to understand the vasculitis, and because we are only looking the AVM, and once we are going, oh, it is no AVM, oh, it is no aneurysm, then what is this? Then this is this, then what we will do, what we can do. So we have to refer properly, or if we can treat properly, or we can explain properly, we can educate the patient properly. I think it's a big, an addition for the family also, and the patient also. So here, there is the history and the physical. So the onset of the primary angiitis central nervous system is usually insidious, and the course is slowly progressive. Acute presentation have also been reported, but rare. However, less common symptoms of the primary angiitis central nervous system are non-specific, and multiple symptoms are usually presented at the initial presentation. Headache is the most common presenting symptom. Other common presenting symptoms include cognitive dysfunction and the stroke. Overall presenting symptoms and the signs from the most common to the least common include the headache, cognitive dysfunction, stroke, thoracic, ischemic attack, aphasia. Visual symptoms include visual field deficits, blurred vision and the double vision, seizures, ataxia, papilledema, intracranial bleeding, and we can say the amnestic syndrome. And the combination of the symptom is usually present in the most patient, and we can say the primary angiitis central nervous system should always be considered as a possibility in case of the rapidly progressive cognitive decline and the personality changes of unknown etiology. But here I want to mention, so when we are talking about that, they're the least common, and or we can say from the most common to the least common sign and symptom, headache is the most common. Then cognitive dysfunction, second common. Then stroke is a third common. Transit ischemic attack, fourth common. Aphasia, fifth common. Visual symptoms, sixth common. And then seizures, ataxia, seventh and eighth common. And then papilledema, intracranial bleeding, and amnestic syndrome or amnesia syndrome. These are also important. For the evaluation point of view, diagnosis of the primary angiitis central nervous system is difficult due to the absence of the biomarker in the setting of the variety of non-specific presentation. Laboratory investigations like the erythrocyte sedimentation rate, C-reactive protein, rheumatoid factor, anti-neutrophil cytoplasmic antibodies, ANCA, or the neither sensitive nor specific for the diagnosis of the primary angiitis central nervous system. The only useful laboratory investigation is cerebrospinal fluid examination, which shows the abnormality in more than 90% of cases, and the mild increase in the leukocyte count to total protein or both is seen in the majority of cases. Radiograph findings are quite useful in cases of the primary angiitis central nervous system. An abnormal MRI is seen more than 90% of the cases, and the primary angiitis central nervous system with ischemic being the most common abnormality noted. So the diagnostic criteria for the primary angiitis central nervous system formulated by the Calabrese and the Malik are used for the diagnosis, and the diagnosis made if all of three diagnostic criteria are met. So these include the presence of an unexplained acquired neurological deficit after extensive investigation for other causes, and the presence of the evidence of the inflammatory arteritic process within the CNS by either angiography or the histopathological examination, or we can say the both hand, no evidence of any other symptom, vasculitis or any other disorder to which the angiographic or histopathological feature can be the secondary. Furthermore, the principal tool in the diagnosis for the primary angiitis central nervous system are conventional angiography and the central nervous system biopsy, and abnormal finding noted in the angiography include the alternative segment of the stenosis and the normal or the dilated segment and the arterial occlusion. Magnetic resonance imaging may be used in the diagnosis instead of the conventional angiography. However, it is a lesser sensitive and compared to the conventional angiography. Central nervous system biopsy. A central nerve biopsy can also be used in the diagnosis of the primary angiitis central nervous system. However, the sensitivity of biopsy is lower and the specificity is higher, and the diagnostic approach, which combine the clinical laboratory and the radiological finding with angiography and, if required, biopsy, is the most prudent. So I want to show you here one thing. So this picture I want to bring in your knowledge that definitely MRI is showing here, and you can appreciate on the contrast and the non-contrast, both the MRI in front of you, and you can see the how the this angiogram in front of you, and how important is the angiogram, and where there are the arrows showing, you can appreciate there is a, we can say there is a the dilatation and the stenosis, and these lesions are important to understand, and it will help you to diagnose the primary angiitis, or we can say primary CNS vasculitis, or you can say the primary angiitis of the central nervous system. So these things are very, very important to understand here, and I hope you understood that. I'm going to further. Regarding the treatment and management, the treatment strategy for the primary central nervous system vasculitis are primarily derived from case report and cohort study. In the most patient, use of the glucocorticoid alone or in combination with the cyclophosphamide was shown to improve symptom, and the response rate for the both, we can say, the monotherapy and the combination therapy were found to be similar, around 80%, and the general recommendation is to start oral prednisolone therapy promptly at the time of the diagnosis at an initial dose of 1 milligram per kilogram per day, and in responsive case, we can say the cyclophosphamide should be started promptly, and the sufficient duration of therapy is 12 to 18 months in most patients, and in patients with the more severe presentation, 1 gram methylprednisolone per day for 3 days along with the cyclophosphamide can be used. However, the evidence of the intravenous steroid being superior to the oral regime has not been noted, and the pulses of the intravenous methylprednisolone can be given as required for the disease flare. And in case of the primary angiitis central nervous system resistant to both the glucocorticoid and the immunosuppressant tumor necrosis factor alpha blocker, we can say the infliximab or etanercept, or we can say the and we can be used to treat the disease, and these should be used as the adjuvant therapy along with the standard therapy and the prophylactic therapy against the pneumocytic or we can say the osteoporosis should be given to all patients along with the standard therapy. So the serial MRI and the MRA every 4 to 6 weeks after initiation of the treatment, then every 3 to 4 months during the first year, along with the thorough neurological examination, are indicated for monitoring the course of the illness. And the differential diagnosis, when considering the possibility of the diagnosis of the primary angiitis central nervous system, it is important to rule out other conditions such as the mimic primary angiitis central nervous system, and this mimic condition can be grouped as below. And the first group is termed as the reversible cerebral vasoconstrictive syndrome, which include the Call Fleming syndrome, or we can say the marginalis vasospasm or postpartum angiopathy. So these conditions bear the closest resemblance to primary CNS angiitis, and they can be differentiated by their acute onset and the normal CSF finding. On further testing, even though the angiography may be abnormal in these cases, and the biopsy will never show vasculitis changes. And the second group of the disorder, which can mimic the primary angiitis central nervous system, are secondary central nervous system vasculitis, and this is a broad grouping which encompasses numerous infection, rheumatic, anti-inflammatory disorder, along with other disorder which can secondary cause the central nervous system vasculitis, and the infectious cause of the secondary nervous system vasculitis include the bacterial, and we can say the tuberculosis, syphilis, viral Epstein-Barr virus, and the fungal candida or the aspergillus, and the rheumatic. Autoinflammatory causes include the Sjogren's disease, SLE, Behçet syndrome, among other, and other disorders which can cause the central nervous system vasculitis include the moya disease and the fibromuscular dysplasia and the radiation vasculopathy. A complete workup for these secondary central nervous system vasculitis should also be made before confirming a diagnosis of the primary angiitis of the central nervous system. Regarding the prognosis indicator from the randomized control trial, which lacks cases, or we can say the less cases of the primary angiitis central nervous system. However, data obtained from the retrospective observational studies show the favorable outcome when patients are treated with either glucocorticoid or in combination with glucocorticoid and the cyclophosphamide, and some degree of the reduction in the life expectancy is observed in the panangiitis or primary angiitis central nervous system cases, and when compared to the general population, poor outcomes are found to be associated with the large vessel involved. When the large vessels are involved, then the scenario is getting worse. And complications, the patient may have the prolonged critical and clinical course lasting years, and additional flare can result in worsening or neurological deficit. And the recurrence rate in some studies is reported to be 27%. Prolonged steroid and use of other immunosuppressant medication for the maintenance treatment is associated with the significant side risk of the hypertension, type 2 diabetes, and the increased risk of the opportunistic infection. Here we need the consultation for the neurosurgeon, neurologist, rheumatologist, internist, endocrinologist, radiologist, pathologist, everybody we have to involve, because the patient needs the attention from everywhere. Osteoporosis is there, hyperglycemia is there, in risk of infection is there. So we have to take a big consultation pool for this patient. And regarding the patient must be advised that the potential chronicity of the disease process, side effect, and the need for the close monitoring for the medication like the cyclophosphamide and steroid must be explained to them, and the lifestyle modification and the aggressive treatment of underlying medical condition like the diabetes mellitus, hypertension, osteoporosis must be pursued, and patients should be advised to take we can say the pneumocystitis, pneumonia prophylaxis if they are in a long-term steroid therapy, and the frequent CBC monitoring on cyclophosphamide therapy is advised. As you know, this is the diagnosis and the management of the primary angiitis central nervous system is a complex, and we can say the best done with the interprofessional team. But here I want to tell you one, just humbly, I'm revising few things, not much, but I'm trying to close this conversation soon, which is the central nervous system vasculitis is an inflammatory brain disease targeting the blood vessels of the brain and the spinal cord, and in this disease, cell of the immune system attack the brain blood vessel wall, which lead to swelling and the damage of the wall itself and surrounding brain tissue, and patient may experience seizures, headache, a difficulty with memory behavior, or we can say the cognition. In some patients, the vessel wall swelling is also severe that cause the critical low blood supply to the brain tissue fed by that vessel, and clinically the patient may be then experiencing stroke-like symptoms or suffer an ischemic or hemorrhagic stroke. In addition, the inflamed and the swollen wall may become sticky, which increase the risk of the clotting and the further reduce blood flow through the affected vessel. The the second thing it is you have to remember there is a seizure, intractable seizure status, headache, stroke. Other severe focal neurological deficit include impaired vision, speed deficit, movement abnormality, severe diffuse deficit such as the memory deficit, cognitive dysfunction or behavioral problem, and the psychiatric symptoms such as the hallucination or fluctuating level of the consciousness. These all are very, very important here to understand. So this is the central nervous system vasculitis, represent a heterogeneous group of the inflammatory disease vasculitis or cerebral angiitis and affecting the wall of the blood vessel in the brain and the spinal cord and the meninges. That's why we are telling that the primary angiitis of the central nervous system, this terminology, primary and confined to the central nervous system with no involvement of other system and referred to as the primary angiitis of the central nervous system, and secondary occur as a context of the systemic inflammatory or infectious process. So we have to understand here why we are using the word primary here, and you know there is a as I mentioned before, there is a granular I can say the granulomatous vasculitis, and which is very, very common, and I want to show you here. And this granulomatous, you can see here, this is how it is behave like that. This is the granulomatous example for the understanding, and this is the we can I want to show. I am showing here you the T1 weighted image, and I have the option to show one more here, the 2T2 coronal image, and you can appreciate here how it is look like, so you can understand these things. And I hope if you like it, please subscribe me, share and support. I try to explain this in detail, and but if it is satisfy your hunger of this information, okay. If not, then write for me. I will make one more detailed lecture for this. Thank you so much, and see you with one more lecture.